Let's look at the spleen meridian. The spleen meridian is the yin meridian that corresponds to the yang meridian of the stomach. The stomach meridian, as we saw, runs on the lateral aspect of the crest of the tibia. The spleen runs on the medial aspect of the tibia. The spleen meridian begins at the corner of the toe, the medial corner of the big toe. It travels up along the inside or the medial aspect of the foot above the arch. It comes along the medial side of the crest of the tibia, through the knee, up through the inside of the thigh, and it comes up into the hip where it jumps out a little bit, and it runs for just a short way up the belly button, or up the belly to the belly button, to spleen 15, which is located 4 sun, so on the edge of the rectus abdominis, but lateral with Ren 8, or the belly button. Then the spleen meridian jumps back out to about 6 divisions out and runs up to about the second intercostal space, to spleen 20, and then it drops down to the 6th intercostal space on the lateral aspect of the body, and this is spleen 21, the great low. So let's take a look at these individual points, especially the ones that are down low on the spleen meridian, some of the more important points along the meridian. We'll show you how to locate them and how to needle them. Spleen 1 is located on the big toe at the medial corner of the nail. Spleen 1 is a very useful point for helping the spleen to control blood, to keep blood within the vessels. Spleen 2 is just distal. It's on the spleen meridian, as you recall, it travels just like this. So if we follow along this line, the first 5 or 6 spleen points are kind of right where we might expect them. Spleen 1, spleen 2, spleen 3, spleen 4, spleen 5. Our finger just naturally falls into all of these spaces as we move along. Spleen 2, just distal to the metatarsal phalangeal joint. Spleen 3, just proximal to the metatarsal phalangeal joint, kind of in the epiphysis of the head of the first metatarsal, in the epiphysis of the base of the first metatarsal, so just under and anterior, so just inferior and anterior to the base of the first metatarsal is spleen 4. Not to be confused with kidney 2. Kidney 2 is under the navicular bone, so kidney 2 is back just a little bit more. The navicular bone is a bit more prominent on most people than the base of the first metatarsal. So spleen 4 is here, and then spleen 5 is the next space that we come up to. It is just inferior and anterior to the medial malleolus. Now spleen 6 is a very major point. Spleen 6 is located 3 sun superior to the medial malleolus, so 3 fingers, 3 of my fingers equaling 3 of Monique's thumbs, brings us to spleen 6, just on the posterior border of the tibia. So, and again, this is a point that your finger easily falls into. Spleen 6 is certainly a very important point, a 3-star point or a 5-star point, and it is one of the most nourishing points on the body. Just like stomach 36 is one of the most strengthening or tonifying points, spleen 6 also serves that purpose of nourishing the body. The name of it is San Yin Jiao, 3 yin crossing, meaning that the 3 yin meridians, the kidney, the spleen, and the liver meridian, all cross at spleen 6, making spleen 6 a very nourishing point for all those yin nourishing meridians in the body. So spleen 6 is here. Spleen 9 is the next one we're going to go to. 7 and 8 are in here. They're not commonly used, although that doesn't mean they're not important, but we're not going to bother with them today. We're going to go straight up to spleen 9, which is one of our more common points. Spleen 9 is useful for helping to clear dampness from the spleen, so strengthening the spleen and clearing dampness. And then spleen 10 is 2 sun above the corner of the patella, all along the spleen meridian. So we come up here and we move right into the spleen. If you might recall, stomach 34, 2 sun above the lateral corner of the patella. Spleen 10 is 2 sun above the medial corner of the patella. I'll show you how we needle some of these points. Spleen 4, again, the master point of the Changmai. That needle goes in just under the first metatarsal, under the base of the first metatarsal. Spleen 6. These are all perpendicular insertions. And Spleen 9. And again, you can probably almost see how easy that is to locate. We just travel up the medial border of the tibia, and when you come into the epiphysis of the bone, where the bone begins to flare out, your finger just naturally stops, and there's Spleen 9. Okay? Let's move up and take a look at some of the other spleen points further up on the body. So continuing on from Spleen 10, which is 2 sun above the medial corner of the patella. Spleen 11 is about halfway up, and Spleen 12 and 13 we find up in the area of the pelvis. Spleen 14 and 15 come to the fourth sun, or the mid-clavicular line, out from the midline. So this is the spleen meridian showing up here. And really the landmark point here is Spleen 15, which is level with the belly button. Perhaps you recall Ren 8 and stomach 25 at 2 sun out, and then Spleen 15 shows up at 4 sun out. Then the spleen meridian moves further lateral along the side of the chest and travels up to the second intercostal space, which will be spleen 20, and then it drops back down to spleen 21. And spleen 21 is our final point, which is a fairly commonly used point. It's the great low point of the spleen, and it's used for a number of different disorders. Some people use it for pain all over the body. It's quite a commonly used point. So let me just needle spleen 21. Spleen 21 is in the 6th intercostal space on the lateral midline of the body. So when we're needling again anywhere in the area of the lungs or in the area of the ribs, we always needle on a transverse or a transverse oblique angle. So I'm going to needle in here, and there we go. Okay. So those are the points on the spleen meridian. Let's move on to the next one.